Hello, we're back to Communication Chapter 4. This is part 3 of 3. Now we're going to talk about EMS communications while we're en route to the hospital and the hospital reports that we have to give. The medical radio report provides information to the hospital. We need to advise the hospital that we're coming to their location so they can be ready to take care of the situation. And what we want to do is we want to give a quality report because basically we're painting a picture of the patient with words. We're telling them what we see and they're preparing for this patient by what we tell them. We also use it for consultation if we have to get permission from medical control to or the medical director if we need to administer some medication. So the radio report is a short and sweet and to the point type of report. It's specifically structured to the present, pertinent facts about the patient without telling more detailed information than necessary. Because if we give too much detail, it's going to tie up the radio and take up the time of the hospital personnel that they could be getting ready for the patient. So if you have a critical patient, make it clear that this is a critical patient. It doesn't involve screaming frantically with sheer panic in your voice. Use a clear, steady tone in your voice. Don't talk fast. Don't appear excited. It's very unprofessional. And you're going to provide the hospital with the patient's chief complaint, the mechanism of injury on critically injured patients, or the nature of illness on our medical condition patients, such as a CPR. We're going to give them a set of vital signs, and we're also going to advise the receiving hospital via radio of the treatments that we've provided prior to our arrival at the hospital. If you require medical orders to provide a patient with any medication, such as your chest pain patient being given aspirin, you would contact the hospital and talk to the medical director, the physician on duty, to get permission. So you're going to contact the hospital or your medical control and request to speak to a physician. You're going to paint them a picture and request the administration of aspirin. Remember, this is a medical consultation. Act confident and act professional. Don't call and say, "Hey, doc, man, we got a heart attack type guy, a heart guy, you know. Do you have any questions or orders?" You know what the answer you're going to get? No questions. Just transport your patient to the hospital. You need to be professional. So with our radio report, we're going to identify the unit and who you are. We're going to give the patient's age and sex, chief complaint, in the patient's own words. Remember, the chief complaint is always in the patient's own words, and you want to put them in quotation marks. You want to be brief. You want to give brief, pertinent history of the present illness or injury, such as Medic 111, this is EMT Collins speaking. We're en route to your location with a 66-year-old male complaining of chest pain. The patient's chest pain began approximately 20 minutes prior to calling 911. Very short, sweet, to the point. From there, we're going to give major pertinent past medical illnesses or mechanism of injury. We're going to give pertinent findings of our physical exam. We're going to give the mental status, such as level of consciousness, and we're going to give them baseline vital signs. So in continuing, our patient has a past medical history of 2 MIs, myocardial infarctions, with coronary artery bypass grafts by 4, and states this is similar to his past episode of chest pain. Patient is conscious and oriented to person, place, time, and event, and rates his chest pain as a 10 out of 10. Vital signs are blood pressure 180 over 110, heart rate 100, respiratory rate 22. To continue on, we need to advise what emergency medical care has been given, the response to any emergency medical care, and if necessary, you're going to ask for orders from medical control and give an estimated time of arrival at the hospital, ETA. So going in with on, it would sound something to the effect of, patient took 2 of his own nitroglycerin sprays prior to our arrival. We'd like to assist him with his 3rd spray and administer 325 milligrams of aspirin orally. And our ETA to your location is 15 minutes. Remember, we can give up to 3 nitroglycerin sprays. He's already taken 2 on his own, so we can assist with the 3rd one with medical control's permission. Now, when you're communicating with medical direction, after receiving the order, you want to speak clearly, slowly, and be concise when asking for orders to avoid misinterpretations. So after receiving the order from medical direction, you're going to repeat the order back word for word. And if it's unclear, or if the order seems to be inappropriate, you have every right to question the physician. Such as, and you're going to do it professionally, Dr. Smith, I misunderstood your order. Did you order 800 milligrams of aspirin? And you can go on to explain that your protocol reads 325, not 800 milligrams of aspirin. So question orders that appear unclear or appear to be inappropriate. If there's a misunderstanding between you and the physician and medication is administered improperly, harm can come to the patient, and it'll be your fault because you're the EMT there with the patient right now. So now we need to transfer of care reports that we've made with the verbal report. The transfer of care itself does not officially occur until a nurse or a physician has received a transfer of care report, which is a verbal report. This is when you first get to the hospital and they're trying to assess where you're going to take the patient. So your reporting responsibilities don't end when you arrive at the hospital. You need to give an oral transfer of care report to the hospital staff member who has at least your level of training or greater. Remember, if you don't and you just leave them sitting on the hallway, you can be brought up on abandonment charges. So with the transfer of care report to the hospital, you're going to introduce the patient by name. This is Mr. Smith, Mrs. Smith, and then you're going to summarize the information from the radio report. So you're going to state the patient's chief complaint, past medical history that's not been given previously, any additional treatments given en route to the hospital and the patient's response to the treatment, and any additional pertinent vital signs. So it would go something like this. This is Mr. Smith. Mr. Smith is having chest pain. He has a past medical history of chest pain, coronary bypass, takes medications, nitroglycerin or any other medications, and has allergies to sulfa drugs. When administered, we administered a total of 3 nitroglycerin and 4 baby aspirin. The patient has moderate relief of his chest pain from a 10 on a 10 out of 10 scale. He's now complaining of the pain of being a 4 on a 10 scale. His last blood pressure was 98/60. Next, you're going to get a signature on a chart from the nurse who you have now officially transferred your patient's care. So now that we've covered the communication part outside of the hospital, now we're going to, next chapter, chapter 5, since this is the end of chapter 4, part 3 of 3, we're going to talk about patient care reporting and charting of the patient care.